Hey everybody, it's Dr. Mike Zavella here. It is Saturday, November 28th. It is 12:14 Eastern Time, and we are live from multiple locations because Family Docs Rock. I want to give a big shout out to our friends in Canada, the Alberta College of General Practice, I believe, sent me this hat about 2 weeks ago. But we're going to get right into things here now. Of course, our friend Dr. Kyle Hodebeck is joining us. How are you doing there, Kyle?
Doing well. Thanks for having me.
And our special guest, because he's special because he's wearing a tie. We tried to meet up a couple weeks ago, didn't work, but my good friend, my new best friend in the world, Dr. Peter Sloan, is with us. How are you, sir? How's the tie?
I'm very good, Mike. Thank you very much for having me. And I'm serious. I only wear a tie on very special occasions. And today we've just had one of our national Irish College of General Practitioners meetings in Ireland, and that's why I'm wearing a tie. I was the meeting convener, and I had to be presentable. So I normally don't wear a tie. I normally I like your hat, but I normally wear a T-shirt.
Yes.
So let's we have some limited time here. We could talk for hours, but I'd like to start with Peter's conference. So you did talk a little bit about it. Tell us about the conference and what were some of the topics today, and we'll get into your session as well. But tell us about your conference.
So this was the Irish College of General Practitioners. I suppose the corollary in the States would be the American Academy of Family Physicians, and this was our winter meeting. Happens at this time every year. I've had the privilege for the last 3 years of being the meeting convener, and the theme of the meeting today was the Irish College supporting its members to support patients. Irish general practice has been through huge turmoil in the last number of years. We've had a huge economic collapse here in Ireland, the whole of all over the world, but particularly in Ireland, and we had very significant financial cutbacks imposed upon general practice. And therefore people are struggling very difficultly. So today was really about the college reaching out to its members and saying, look, we are there for you, we support you. So we had a couple of very important sessions. Our keynote speaker was a lady called Margaret Murphy, who works with the World Health Organization as a patient advocate for safety and improvement. She had a very tragic death of her son a number of years ago due to systems errors, so she came and talked about that. And we had a spotlight panel discussion amongst the senior management of the college about how the college is supporting its members by writing reports on various aspects of general practice in Ireland, like rural practice, deprivation practice, manpower planning, where GP trainees, residents are going to go, and what the members in college think. And we presented some of those in a discussion panel, and also then how we transmit and communicate that information to the system, how you can actually try and affect change for family doctors in Ireland, which is incredibly difficult. We had a lot of other workshops in ENT, with a workshop in social media, dietetics, end-of-life planning, lots and lots of a big variety of topics on today. So a very good meeting.
And I saw on the Twitter, because it had a Twitter hashtag. Was one of the topics burnout as well? And how was the discussion on that?
Yeah, so it was a good friend of mine who we have a health and practice program within the college, which looks after doctors' health. And it's a huge big issue because we have an increasing aging cohort of general practitioners in Ireland, with a lot of emigration amongst younger GPs. So we have a big discussion about how to maintain freshness and how not to get burnt out. We still have quite a significant number of single-handed GPs working in rural areas and in urban areas, but it's a big issue, and I suppose the college both tries to raise awareness of it and also highlight to members that there are supports and services within the college available to them if they're under pressure, under stress, or the doctor, you're burning out, you're not any good to your patients. So it's a patient safety issue as well as anything else. So yeah, it was a very important session and a well-attended session.
Yeah, I mean, it's really interesting how just monitoring the Twitter feed, how a lot of the topics are similar around the world when you get to conferences like this. Let's kind of jump to the social media session. I just watched it, and Kyle was kind enough to put it on the Periscope. The name escaped me. So Peter, what was your kind of takeaway from it? From the room? I did kind of see some of the questions and things. What was your impression of how it was received?
Yeah, I think it was well received, but there's, I think, an absolute appetite amongst a lot of family doctors, a lot of GPs for more information, more education around social media. I think that a lot of doctors, particularly older doctors, are very uncomfortable with it, don't know how to use it, don't know much about it, and therefore they really want education around it. And I think that what that means for me is that the college and at European and global level, WONCA, needs to get into that space of actually starting to provide information, educational tools, and to look at research aspects of social media. It's very nice to use it, but we need to start to metric it. We need to start to highlight the power of it. So, for example, we're using social media now to do this interview, and these are very simple ways that you can illustrate to people the capacity that the tools have. But a lot of GPs don't know how to use it and want more information, and I think that that's the big message.
Kyle, let me bring you into the conversation. Obviously, you were part of this social media panel. What was your kind of impressions? I know that the internet was kind of cutting out a little bit, but what was your kind of impressions of the discussion? Is it similar to other discussions that you've had in panels that you've had on primary care and social media in the past?
Yeah, it seems like a lot of us have the same or similar questions as far as using social media, dealing with how to deal with interactions with patients as well as other colleagues, and of course how to curate sources is a big deal.
Peter, there was another person on the panel. Can you tell us a little bit about the other person who was on the panel?
Yeah, it was a dietitian, and I'd never met her before today. The reason I asked her to come and join us was because about 4 months ago there was a celebrity in Ireland who was posting a very inaccurate information about linkages between diet and autism and various other diseases, and they had a very public interaction on social media with the dietitian trying to provide accurate information to the public. So I got in touch with her and said, would you like to come, because it illustrates the challenge of communicating as healthcare professionals with the public, with patients, and amongst ourselves. I think it's a very complicated discussion, but one that we can't afford to ignore. We've got to get into that space. We've got to talk about these things, and we've got to grapple with these challenges. So that's why I invited her along, and I think her contribution was interesting and gives a slightly different perspective as a non-doctor healthcare professional. We always think of doctors, but healthcare professionals, there's lots of them: physiotherapists, dietitians, occupational therapists, psychologists, and they all have a presence as well, and a responsibility and a power to interact with us. So she made a valuable contribution.
And since Peter, since we've actually never met before, and my audience may not be too familiar with you, can you describe kind of your practice situation and kind of how you see patients there in Ireland?
Sure, yeah. So I'm a sessional GP, so I work regularly in 2 different practices. I work both in rural practices, and typically my day will run from 9 o'clock till about 6 o'clock in the day. We'll have a morning, probably somewhere between maybe about 20 patients in the morning, same in the afternoon. We will have about an hour and a half at lunchtime where we will do paperwork or house calls. We have a very big, in rural Ireland, some of the practices have very big geographical catchment areas and quite a lot of house calls to do. And then the unfortunate reality of practice in Ireland for most GPs is that at the end of your working day, after having seen a lot of patients, you have a lot of paperwork to do. Post blood results, follow-up, telephone calls. So, I don't think it's too much different anywhere else you go in the world. I'd say it's probably the same for you guys in the States.
Yeah, that's probably right.
Yeah.
So Kyle, let's why don't we rewind a little bit? So last time I talked to you, you were at WONCA Europe, and why don't you talk a little bit about the rest of that meeting and kind of your takeaway, since we've been away from the meeting a little bit, and then I'll ask Peter too as well. So, but Kyle, go ahead and talk about WONCA Europe.
Too easy. And Peter, I put on a tie as well, so you don't have to. Sure, yeah. So Peter and I were both at WONCA Europe in Istanbul. And it was a really great conference. Speaking of social media, it was really interesting because this was the first time I got to meet some of my peers that I've been working with online for a year and a half now. So this is literally the first time we've met in person, even though several of us have published multiple times together. So that was totally new for us to see each other without a screen in front of us. And actually be there in person. Additionally, in addition to Peter, all of the 7 Young Doctors movements had their leadership present there for their first time ever. So that was also really nice to have a united coalition of leadership there for the junior physicians and trainees, and show our vision as well as kind of the things that have led us up to where we're at this point. We did have a big talk among the 7 of us, as well as Peter and a couple other folks with Vasco da Gama had a really nice social media talk as well that I periscoped for them. And it's just been really good to see how things have been moving along, not just in one region, but inter-regional around the world.
And Peter, so what were your impressions of the meeting? So weren't you the conference chair for that too? Are you still in leadership in Vasco da Gama? And
Yeah. So I had a great privilege of being elected in last July, so July 2014, and I'll be in post until 2017. But the most powerful, invigorating thing about Istanbul was that the 7 of us came together for the first time. There's a real energy that infused the entire meeting. So we had our Vasco da Gama pre-conference for a day and a half before Wonka Istanbul, and all 7 of the leads were invited to come and join our council meeting. And then we had a keynote which was really looking at inspiration, what inspires all of us professionally and personally. And it was a really invigorating experience to, as Kyle said, finally meet people that I've been working conditions and time differences for the last 12 months. To finally meet people in person, I think when we now work together over the next 12 months is that we will have a much more powerful interaction because we know each other. I think as well there was some other interesting aspects of the conference. The percentage of young GPs that were at Wonka Istanbul was very significant. About a third of all delegates there were young GPs. And it's really, you can sense, if you look at Wonka Europe conferences over the last 2-3 years, you can sense the change that is happening gradually in terms of attitude and openness and willingness to embrace innovation, dynamism amongst our more senior colleagues. And right now within Wonka Europe we have very, very warm collaborative relations between the different aspects, the networks, the young doctors, the teachers, the research network, rural practice, preventative medicine. Very powerful ongoing and developing collaborations which really provide a platform for research, education, and those are all very, very good things. So it was really invigorating, and I enjoyed it immensely. It was great to catch up with Kyle again, and it was also great to meet the others, and I'm looking forward to developing that collaboration.
I was really impressed because I appreciate Kyle broadcasting that panel about your story, about why you use social media, why you're passionate about digital communication. Why don't you share with my audience, Peter, why do you think social media is important? Why do you think it's important for primary care and general practitioners?
Yeah, I think the fact, for me, it's a fact of life. It's there whether we like it or not. I think the truth is that as healthcare professionals, we have a responsibility to empower our patients with knowledge, accurate knowledge, information. I've always felt very strongly that as a doctor, if I empower patients about their own disease, about their own illness, if I provide them better information, that doesn't make me a less good doctor. In fact, I hope it makes me a better doctor. So one of the tools we now have at our disposal to do that is social media. If we're not in that space as healthcare professionals, they're going to be in that space anyway, and they become, at risk of poor information, bad information. They become at risk of getting false hope about medical conditions, about treatments, about cures, and it can cost them very large amounts of money. So I think we need to be in that space. The key thing for me when we're in that space is to know how to use it, and I think that the reality is that we're only really now beginning to develop the tools to start to see how to use it. I can see, for example, in the workshop we did here today, there's a great reluctance on behalf of a lot of doctors to take that step, to take a step in and experience it, because it can feel absolutely overwhelming. And from a personal perspective, that happened to me. I remember I went to a meeting in Barcelona. I came back from the meeting and I had like about 60 requests on Facebook, friend requests, and I looked at them for a month and said, right, am I in or am I out? And I said, right, okay, I'm in. And I really went from there, and I've become somebody who people turn to and ask about social media simply through using it. So the truth is that we don't have expertise to a significant extent at institutional level amongst the American Academy of Family Physicians and the ICGP, and we need to build that expertise to help doctors to know how to use social media. So that's what really my passion is. I, I think one of the things that I tell people is you need to learn how to turn it off. A lot of people are not very good at turning it off, and it's no different than the telephone, no different than any other tool. It's about how well you can use those tools, and that's part of what I'm passionate about, helping people use the tools.
Yes, so yeah, I was going to ask you about that, Peter. Maybe you can help me out, have a little intervention. So how can people turn off social media? What advice do you have about that? And he's
Yeah, I think what the key to it is not just I suppose one of the things that we have that older doctors have, or we had, is if you look, for example, teenagers and medical students, medical residents, or people in their early 20s, they all simply have social media. They grew up with it. Whereas if you come to it after the fact, so that you're going to decide, right, I'm going to sign up for Twitter, I'm going to sign up for Facebook or LinkedIn or one of the different platforms, you have the opportunity to decide how you're going to use it. You can decide what presence you want to have, what image you want to do, and what way you want to engage. And I think what I would say to people is think about what the purpose of using social media is. Is it that you want to involve yourself to get access to research? Is it that you want to follow other GPs? Is it that you want to tell people what you had for breakfast, which is fine, but it's not my beef. So decide what way you want to use it and then stick to that. And never forget the importance of human contact and interaction and talking face-to-face to other people. So harness it as a tool in much the same way you would use a telephone or other tools. And how do you turn it off? It's quite simply
I think he was cutting out. I think Kyle, we were getting the answer, and then his connection cut out.
I turned you off.
See, that's the tip. He turned us off. So Kyle, but before I let you go, and I'm going to be winding things up here pretty soon. So Kyle, why don't you give us an update on one word for family medicine?
Sure. So right now we're just over 80 countries, and I mean, we want to get all of them, but we really want to get 100 by Rio de Janeiro next year, which is the Wonka World Conference. And most recently today, when we were in Ireland talking, we presented for the first time the image for Moldova. And I don't know if I can show you here. I have it up.
Oh, I'm so excited.
I wonder if it will let me do it.
Let's see. We have the technology. We'll see if we can.
See if this will work. Screen share.
Kyle's so technical.
We'll see if it'll work. Actually,
let's see. I know you can do it. I know you can do it, buddy.
I know we can do it.
I know you can do it. Let's see. Let's see.
Can you see that?
Oh, there you go. There you go.
Right here.
That's good.
So yeah, that's the country Moldova, their flag, and then one of their most famous monuments is a statue there. So let me go back to where I'm at, and I wonder if I could turn this off now. There we are. Cool.
Wow.
That was the first time I did
great.
Cool. And where else are we at now? I'm working on Kosovo right now, and we have a couple other areas we're in discussion with, but I'm not quite at doing their images yet. Definitely need to update the hardcover book that you mentioned, Peter, during the talk. We have about 20 more images we need to add in there. We brought some of the books to Istanbul as well, and they sold pretty well, like hotcakes, and a lot of people who were involved in the project were obviously really interested in getting a copy of the book. So hopefully we'll be able to update that pretty soon. And we do have a couple of publications coming out in New Zealand as well as Mexico pretty soon. So that's about all I have on One Word for Family Medicine at this point.
Now, did I hear that during the Periscope that that you may have to update the Irish image? Is that right? Or?
No. I think that there's a lot of controversy about that. You know, it's 3 or 4 leafed. I don't know. Can I mention one other thing, Mike? Which
Absolutely.
Is just one of the things that we saw when you were looking, we launched our ePDF on social media, a social media guide through experience. And this is the type of space that we really need to get into, and it provides a vehicle for people like Kyle to describe and explain how they're harnessing the power of social media, innovative ways that you can do it. So these types of things are important and provide great opportunities. I'd like to pay tribute to my colleagues in Vasco da Gama who put it together. It's a fantastic publication. It's on our website if you want to go and have a look. And it should be a very useful roadmap and guide to help people navigate their way through the different platforms.
Wow, that's great. Yeah, I think that was recently posted or recently completed. I think I saw a copy of that, and it was really well done. A lot of hard work did go into that. Looks like. Yeah,
a very, very good publication. Yeah.
All right, so yeah, I think we're going to close things up here. So Peter, any last words from your meeting, or any last passionate or words of wisdom for family docs, for general practitioners on using social media communication?
Yeah, just give it a go and take care and dip your toe in, and I think that you will probably find that it really is an invigorating experience and will help you enjoy what you do and feel connected to family doctors all over the world. A very powerful way to find out what's happening in different countries. And just like to say as well, Mike, thank you very much for having me on, and I really do love that hat.
Well, thanks. And Kyle, before I let you go, you got the last word. I want to give one more plug for Wonka Rio next year.
Sure. So anyone in North America or around the world, if you're interested in what's going on, please check us out at Wonka Polaris, as well as Wonka Polaris group on Facebook. And as far as Rio is concerned, that'll be next November, right, Peter? 2014.
Yeah, November 16. Yeah.
And they are accepting abstracts through, I want to say they extended it through 1 February, so all the way through the end of January. So anyone who's interested in presenting, please go ahead and submit there. And hopefully we'll see you all in Rio if we don't see you sooner.
All right. So thanks to my guests. I'm going to put this up on my website pretty soon. This is, again, kids, as I tell you all the time, the power of social media, primary care and family medicine, general practice. And if it wasn't for social media, I wouldn't have met both of these fine gentlemen. So I'm Dr. Mike Stavella and drmikestavella.com, and I will see all of you very soon. So I will stop this recording right now.